2-year-old Banksia is an IVF miracle.
It took us about 1.5 years to get pregnant, and she was our last frozen embryo, our 6th embryo.
Hayley and Scott went through Tas IVF to conceive Banksia. They're hoping to soon give her a sibling, but this time the Tasmanians are flying interstate and going through a Melbourne-based IVF clinic that bulk bills, and they're not alone.
In 2024, we've seen a 40% increase in new patients travelling from Tasmania to access IVF at Adora Fertility.
And all I had to pay really was the flights over, and we've saved probably about 20 grand.
Elise and Nick also had their daughter Lucy through Tas IVF after 4 miscarriages.
A lot of people struggle with the lack of option, I think, and the lack of resources we have here in Tassie. It is really hard, especially when you don't live in the south of the state.
There are only 2 private IVF providers in Tasmania. The AMA wants the Tasmanian government to make IVF more accessible by providing public options.
The strategic question the government needs to decide is, should the government actually set up its own service or should it work in collaboration with existing services?
We need more accessible, more affordable IVF for Australians, and that would include Tasmanians.
Tas IVF says it's in discussions with the Royal Hobart Hospital about providing IVF services to public patients, and it hopes those discussions progress.
I feel like a lot of families probably aren't in a position where they can afford IVF, and I think it's really unfair that then they potentially won't have a family because they can't afford it.
Families hoping one day others have more affordable options. Monica Champ, ABC News, Launceston.